All right, welcome back. We are very pleased to have Dr. Shane Prejean with us from the Cardiovascular Institute of the South. And you heard the bio I announced before. Very well informed, and he's going to give us good information today. Doc, good to have you on board. How are you?
Nice to be here. Doing well, Martin. Thank you for having me.
All right, anytime. And I know y'all have seen a lot as heart doctors. Y'all first saw the COVID original come into play, and it was doing some weird things to the heart and different things to look for. With the Delta variant, what's changed? Where are y'all looking now with what is it doing to the heart exactly?
It's a good question. As you know, Delta has now, kind of with this fourth wave, become the predominant strain that's infecting patients, and really it's more of the same in terms of the virus, but the big difference has been the transmissibility of the Delta variant. So we're seeing it affect a lot of people all at once, and particularly younger patients have not only become ill, they become fairly severely ill. And also, once you become severely ill with COVID, we start to see some of the heart manifestations.
You know, and I thought about how to ask this. You just have to almost dive in and ask it that you're seeing patients, younger patients with this one. Now, I guess in the COVID-19, the original version, you had older people coming down that either had new heart conditions or it manifested and attacked some of the ones that they had already. With the younger patients, is it heart related? Are you seeing some things in the younger patients?
Yeah, so having been kind of on the front lines in the hospital, recently just covered the last 2 weeks, so it's really been in the peak of the surge. COVID can affect you in a bunch of different ways. So the three kind of main groups that I've seen this in is number one, if you have an active COVID infection, it can make you sick, which puts strain on the heart. But COVID in itself has been shown to be a very inflammatory virus in the way that the immune system tries to respond to the virus. We've seen that in inflammation in the heart. We've seen it in inflammation in the blood vessels. And then we've also seen that COVID is a virus that really is prothrombotic, meaning that it tends to cause the virus itself, and then the immune system's response to the virus tends to lead to more clotting than in a normal illness. So that's for the group that has COVID. Mm-hmm. The other group is people with heart disease. So what do you need to know if you have heart disease? So people, it was shown in the first strain of the virus, and it's still true with Delta. If you have heart disease, you're more susceptible to getting the virus, and you're more susceptible to dying from the virus or getting severe illness. And then lastly, if you don't have COVID yet and you don't have heart disease, how is COVID affecting you? It's affecting you because the Delta has peaked so rapidly that it has completely filled the ICUs and emergency departments in this state. So we're dealing with the COVID patients because of this Delta virus, because it's so transmissible. It's spread like wildfire. And now the patients that don't have heart disease or COVID still have to worry about it because they can't get into the hospital as easily, because if they get sick, it might be full of patients that are dealing with this Delta spike.
So this has remapped everything you've sort of gone to school with and you've learned, and the traditional things that you would deal with when you're dealing with heart patients. I'm not going to say it's thrown y'all a curve, because y'all adjusted pretty well doing it, but you're seeing different things out of the norm, aren't you?
That's right. So it's really a new frontier. You know, when you're encountering an illness that just came about, it's not in the textbooks. You know, it's not something that you can go look up and say, this is how I treat X, Y, and Z. You know, it's new. So we learned, obviously, from the patients that we've treated before, but you kind of have to just expect the unexpected and know that the virus has so many manifestations it can present in different ways. So normal person in their 30s, if they were sick, say with another illness, we wouldn't expect them to have be at high risk for a heart attack or at high risk for a blood clot. But we know that when they have COVID, we need to be looking for those other things that might affect the cardiovascular system, affect that patient in a way that we wouldn't have normally expected.
With about a minute left on this segment, we'll come back for another one, of course. Is this virus sort of tricking the heart? I mean, is it the cytokine storm? Is it, you mentioned inflammation. The virus is sort of playing tricks with your body, isn't it?
Yeah, so that cytokine storm that you mentioned is pretty profound, and that is the body's response to try and kill the virus or suppress it so that you eventually get better, but it's kind of like friendly fire to all the other organ systems. So the heart itself can become inflamed, and when it does, it gets weaker. The blood vessels themselves can become inflamed, so you can, when you have a heart attack, it's the blood vessel supplying the heart that's the problem, so those vessels can become involved. And then also when the heart becomes inflamed, it puts you at risk for abnormal heart rhythms, inflammation surrounding the heart, like we term pericarditis, or getting fluid around the heart. So any structure of the heart can become involved, and it's either COVID itself or the body's reaction to COVID that's really causing problems.
You were mentioning pericarditis. I guess I said that right. I hope I'm close. Anyway, what exactly is that, and why are y'all seeing more of that with this virus?
So when you think about an itis, that's just inflammation. So that's the medical term we put at the end of something else that says that particular structure is inflamed. So the two bigger diagnoses that's been associated with COVID have been myocarditis, meaning the muscle of the heart is inflamed, or pericarditis, the surrounding structure of the heart. So that's a lining that just kind of holds the heart in place, and it kind of helps protect the heart. So either of those can become inflamed. Pericarditis is something that might cause chest pain as a predominant symptom, especially when you move in certain ways or take deep breaths. And then myocarditis would be inflammation of the heart muscle, in which that might cause the muscle to become weak and give you symptoms of what we call heart failure or congestive heart failure. So the heart gets weaker, it can't pump to the rest of the body as good as it should, and then sometimes fluid will back up into your lungs and make you short of breath. So shortness of breath and kind of fluid building up would be the predominant symptoms of that. And that is also associated with some abnormal heart rhythms as well.
Now, is that tricky because sometimes the virus attacks the lung and there's pneumonia, but I guess for a patient who's short of breath, could it be multiple things? That's why they have to get in and get checked, right?
Absolutely. So if, a lot of COVID patients can be successfully managed as what we call an outpatient, either at home or in clinic. So they should be monitoring their symptoms, and if they notice that they're more short of breath than normal, where it's difficult to kind of walk short distances or do things that even if you're sick you would normally be able to do, that's when you should kind of seek medical attention. The lung part of the virus can cause your oxygen saturation to be low, so a low oxygen saturation, noticing that your heart rate's running high, those kind of things may be things that you might want to get checked out, and you should call your primary care doctor, and inquire about when you should really seek care or medical attention. We're asking that you do that because if you a lot of times when people kind of flock to the emergency department, sometimes it's leading to increased wait times, and if you can kind of check with the primary care, say, hey, this is what I got, what do you want me to do? That's all often helpful.
So your pulse ox has the oxygen and the heart rate.
Right.
Two very important things to look at, right?
Exactly.
Right. Good deal.
So in addition, pericarditis and myocarditis have kind of been in the forefront, publicized, but one of the other big issues has really been the association with COVID and clotting. And you mentioned, blood thinners before, so we can get into that.
Yeah, because the blood thinners, I was trying to research it. There's a lot of people on blood thinners. Does it help? Does it hurt? What does it do?
So we wouldn't So we wouldn't do it in the absence of an indication. So in the first couple waves of COVID, it was noticed immediately. You know, it was very common to not only be sick from COVID and have the pneumonia part of it, but also to develop a blood clot that either is in your leg, starts in your leg, and travels to the lung. We call that a pulmonary embolus. And therefore, doctors on their own, because we didn't have any information from before, started experimenting with, hey, should we just put everybody on blood thinners? What should we do with this? And the latest data basically just show that if we do diagnose those conditions, absolutely you need to be on blood thinner. If we're suspicious for that condition and we have not yet been able to confirm it, a lot of times we'll put you on blood thinner to cover you. If you don't have that condition, then what we're doing is being aggressive in a lower dose of blood thinner to prevent blood clots. So if you're hospitalized with COVID, you'll be on a blood thinner, a low dose, probably a little shot, to help protect you from developing a blood clot if you don't already have one.
And real quick, we have about a minute left, and I do appreciate you taking time. And I promise I'll get you out of here quick because I know you have a lot of rounds to do. But just in general, once again, what's the biggest thing a patient, especially who has a pre-existing condition, a heart condition, needs to look for before they seek help?
I think that any worsening in your baseline, so obviously if you have heart disease, if you don't have any disease at all, the biggest way to protect yourself from getting severely ill from COVID has been vaccination. So you should talk with your doctors, the doctors that know you well, have those conversations about vaccination. That's the number one way you can protect yourself. Number two is if you happen to get COVID, know that you're you already have medical conditions, so you may be at higher risk. Number three is if you don't have COVID, know that you should stay on top of your medical conditions because the healthcare system is very strained right now. Stay on your meds, keep in touch with your doctors as best you can, and know that if you do get ill, it may be complicated and resources are somewhat limited right now.
All right, Dr. Shane Prejean, we appreciate you joining us. We look forward to seeing you a bunch more times here, and welcome back to the area. Looking for some great things from you, but you hit the ground running big time, so I know you're busy, but thank you for joining us.
Thank you, Martin. I appreciate you having me on, and again, the CIS is a great resource for patients here in the community. We look forward to seeing patients, and if they have any questions, they can contact our clinic.
All right, there you have it. Dr. Shane Prejean right here on Bayou Time. See you right after the break.